Hello and a very good afternoon to all our viewers who are joining me in this live interaction session on News 9's Facebook as well as YouTube page. And as we all know, COVID-19 has been spreading its tentacles across the globe like no other flu in the past. And the latest spurt of infections is probably fueled by the second wave in most of the European nations and the third in the United States. And in India and South America, it is the tail end of the first wave which is giving rise to the spurt in new cases. So far, the world has in fact seen 4 global waves of COVID-19. The first wave of the infections, which started in China, reported the first batch of infections in December 2019. And after a rapid initial outbreak, China somehow managed to control the outbreak by the end of February, marking the end of the first wave. But the first wave of COVID-19 was just a teaser because the second wave was even more lethal, and the second batch of COVID-19 cases in Europe sent alarm bells ringing across the world. And the healthcare infrastructure in Italy, Spain and also Brazil were overburdened and down on its knees. In fact, just a week after the daily infections in Europe surpassed the 100,000 mark for the first time, the new case trajectory in the continent is at an all-time high, with new infections crossing close to 150,000 for the first time last week. But somehow at the end of the second wave, Italy and the rest of the European countries managed to control the infection. And just when the world thought the second wave of COVID-19 was waning out, the third wave in the United States, sent alarm bells ringing once again. The US has reported an average of 55,917 new cases every single day in the past week. And this is the highest that the 7-day average of the new infections which has touched in the country since early August, when the second wave of infections was, receding. So the scientists have warned that the third wave is likely to surpass the peaks of the second wave. And while every wave of cases has been stronger than the one it precedes, the same can't be said for the deaths, because with time, scientists are becoming better at saving lives from COVID-19, and as a result, the peak of deaths reported during the second wave of cases has never been surpassed. So now, despite the fact that the third and now the fourth waves have had a far higher number of cases, countries like India, which saw its peak in the third global wave, somehow managed to keep its mortality rate better than the world average. And what we have to know is that we are currently in the fourth global outbreak of the COVID-19 pandemic. So in order to give us a few more details and also more insights into this particular topic, we have with us Dr. Sitesh Roy joining us live from Mumbai. Many thanks for joining me, Dr. Sitesh Roy. And the first question today is, what do you think about this particular report? Are we in the fourth global outbreak or the fourth global wave of COVID-19 outbreak, Dr. Sitesh?
Yes, Deepak, we are definitely seeing a rise in cases in Europe and also in the US that had shown a decline in cases, as you rightly said. Europe had shown the decline after June and US had shown the decline after August. But now we have again seen increases in UK, in France, in Germany and in the United States. And these increases are enough to the point where there are night curfews being placed, there are limitations and restrictions being put on movement, and certainly the number of cases are increasing. And there can be several factors behind this, including the colder weather as the temperatures drop across the colder regions of the world as October, November sets in. And also the movement of people as the unlocking procedure had progressed in different parts of the world, because we know that this virus does not move on its own. It's people who move the virus, and as people are moving more, the virus is also moving more.
Now, Dr. Sitesh Roy, one question which is, very common in the minds of the people is whether the new wave of COVID-19 infection is probably stronger than the previous one or not. What do you have to say about that?
So in terms of the number of cases, definitely Deepak will be picking up much more cases now because we have much more efficient testing in place. We don't just have the nasopharyngeal swab and throat swabs with the RT-PCR, we also have the rapid antigen tests, and we also have more varieties of antibody tests available, as well as salivary antigen testing available in several parts of the world. So we are definitely going to pick up more and more cases than we have in the past waves. But as you rightly pointed out, the number of hospitalizations and the number of deaths are hopefully not going to be as much as we saw in the second wave that hit Europe especially, and subsequently hit US in the third wave. Because we do know a lot more about the pathophysiology of this virus, and we do know how to treat it better and how to prevent some of the complications that we were seeing before.
Now, doctor, one of the observations that I made during this report is that during the second wave, the cases were high and so was the fatality. And in the third wave, the cases were high and the fatality was a bit low. And in the fourth wave, which we are currently in, the recent spike in cases is highly contagious than fatal. So what do you have to say about this particular observation, doctor?
So we know that the D614G mutant of the SARS-CoV-2 virus, which is presently the most prevalent strain of COVID-19 virus that's circulating in the world, is much more efficient in spreading. We know that it does spread from person to person and also latches on to the ACE2 inhibitor of the human cells much more efficiently, and also the chances of super spreading, which may have been fewer in the previous waves, is much higher now. And all of this just points to the fact that we have a very efficient transmitting virus in our midst, and there are a lot of people who've never seen it before, so they are prime candidates to get infection. And as human interaction grows, as world travel again gets beginning, as people start moving for work and business again, we will see increases in the numbers with these new mutants that are there. But fortunately, they are not mutating any further at this point of time.
So, doctor, during the first stage or the first wave of COVID-19 outbreak, the public health infrastructure was down on its knees. And over the span of, close to 7 to 8 months, the infrastructure of the healthcare facilities has been developed. So, do you think that we can somehow curb the fourth wave, or what would be the situation in the next 5 to 6 months?
The healthcare infrastructure, Deepak, can't potentially curb a wave. It can help manage the wave. So it can manage the patients who are coming into the hospital or into the clinics or getting admitted in the ICU. Managing the wave is still a personal social responsibility of every single human being. So when a person comes down with a fever or a cold or a cough or a sore throat, they really need to isolate, quarantine themselves, get testing if they need to, see their doctors, see their healthcare professionals, and prevent spreading it not just to their friends and colleagues at work, but also to their family members. So I think when we talk about preventing the next wave and flattening the curve of the next wave, I think it is each human being who wears his mask and wears it correctly, who hand washes and hand sanitizes frequently, and who maintains physical distancing, who is really going to curb the next wave. The healthcare infrastructure will help manage those of the 5, 10 or 12% who really require admissions and treatment. Whereas really it's mostly outpatient at this point of time that the care of SARS-CoV-2 and COVID-19 needs to happen.
Right, Dr. Sitesh, many thanks for joining me in this live interaction. Well, there you heard it. In order to flatten the curve of COVID-19 outbreak, which is the fourth wave currently, and we'll have to follow all the safety and precautionary measures. And the current, the number of cases across the world with respect to COVID-19 has crossed the 40 million mark. So, like I mentioned earlier, every new wave is stronger than the previous one. So, we are in the fourth wave. So, this is potentially stronger than the third, second and the first wave of COVID-19, and indeed it is a cause of concern. So at a time like this, it is our responsibility to not let our guards down, wear our masks, and also follow all the safety and precautionary measures which are listed out by the Home Ministry and also the respective state governments, because only these measures would help us curb COVID-19, because we don't have a vaccine yet. For the vaccine to be developed and to be administered to the entire population of the country, it would take another 6 to 7 months or even more than that. So until a vaccine, a concrete vaccine is ready for the public use, it's the only thing that we will have to follow is the safety and precautionary measures. Like Dr. Sitesh Roy mentioned, hand hygiene and also wearing a mask is very mandatory in public. So with that, it's a wrap on this live interaction session. So if you guys have liked this piece of information that we've shared with you all, please do drop in your comments. And also, most importantly, do like, share and subscribe to News 9 on Facebook, Instagram, Twitter and YouTube. Many thanks for joining us.